This segment is sponsored by Madarva at Stony Point Surgery Center.
Well, good morning and thank you for being with us on Virginia This Morning. I'm Jessica Null. This morning we're exploring the cause of pain, tingling, or even numbness of the wrist. Dr. Jessica Frankenhoff joins us talking about carpal tunnel syndrome. Doctor, it's great to have you this morning.
Thank you.
We were talking a little bit before we got started this morning about carpal tunnel syndrome because people may be familiar with hearing about it. Oh, I've heard about that, or somebody I know had it. But do they typically, when you see patients, know that that's what they're dealing with, or is this still one of those abstract kind of weirdo feelings?
Actually, it is more abstract and people don't really know what it is, although exactly what you said, they've heard about it. So a lot of people think that just because they have pain in their hand and they've heard that hand pain is carpal tunnel, that they have carpal tunnel syndrome. But very specifically, you have to have numbness and tingling in the hand to have carpal tunnel syndrome. So typically a patient will say they'll wake up in the middle of the night and have to shake their hands out because the hands fall asleep. That's one of the key components of carpal tunnel syndrome is nocturnal, nighttime numbness and tingling.
So you're uncomfortable probably when you're performing a certain task, and then you kind of have that same feeling even you might wake up at night.
Exactly. As it gets worse, so initially it's just at nighttime, and typically we'll tell people to wear splints at night. The flexor tendons, so there's things that extend your wrists and fingers and things that flex the ring, and the flexors are stronger than the extensors, so we have a tendency to sleep in the fetal position like this. And so wearing the splint simply keeps the wrist in an extended position, so that the blood can flow there better. So when you wake up in the middle of the night and you're shaking your hands out, you're actually getting better blood flow to the hand, and that makes the tingling go away. And then you fall back asleep again and you flex your wrists, and then you get the symptoms again. So the splinting is just to be worn at night, and it's to prevent you from flexing your wrist to get the flow of blood to get to the hand.
Is carpal tunnel syndrome only because, oh, I've been working too hard clicking that mouse? That's the only thing that's going to make it happen?
No. Actually, there have been studies to show that typing actually helps with carpal tunnel syndrome. But the biggest factors for carpal tunnel syndrome are age and being slightly overweight are the biggest correlations between with having carpal tunnel syndrome. Anybody can get it. There are biological factors such as diabetes or low thyroid that make you more predisposed to developing carpal tunnel. But pretty much anybody can get it. As you age, it's more prevalent. It's about 5% of the population has carpal tunnel syndrome, so it's very, very common.
And once folks come in to see you, is it kind of, oh wow, what options do we have? Only surgery, or you mentioned the splint? Is there a series of things you can do to rectify this?
So first of all, there's not just one carpal tunnel syndrome. Sometimes you can have an acute carpal tunnel syndrome or carpal tunnel syndrome of pregnancy, where there are hormonal and fluid shifts. And typically, for example, in carpal tunnel syndrome of pregnancy, after you give birth, the carpal tunnel symptoms will go away because the hormonal shifts will have changed, obviously. And typically for that, we'll give somebody a steroid shot, and that steroid shots can work for up to about 3 months is the average. And even people who aren't pregnant, sometimes we'll give them a steroid shot. Say, for example, people like, listen, I can't take time off from work right now because I have, I'm busy, or people, who have seasons that are busier than others, so we can give them a carpal tunnel shot. Then, unfortunately, it's not curative, unlike other things that I deal with for other tendinopathies, tendinitises of the thumb, can cure that that entity, but for carpal tunnel syndrome, it just makes it feel better temporarily. So basically, it's splinting, and splinting is only to be worn at night. And sometimes people will come in and they'll have worn the splints all during the day. But if you're having numbness and tingling during the day, or if the splints that you were wearing that initially helped at night no longer help, then it's time for surgery.
Okay, so surgery might be the ultimate option, but usually you have pretty good success with the splinting.
Yes, temporarily. It's usually something that's going to progress and something that eventually will stop responding to therapy, to non-surgical therapy. But yes, initially we don't just say you come in the office and you say you have to have surgery. It's basically based on symptoms.
Great. Well, thanks for the insight. Very complex thing, the hand, isn't it? A lot of stuff going on.
Yeah.
Appreciate the insight. Thank you. Dr. Jessica Frankenhoff, you can learn more about the VCU Health System Department of Orthopedic Surgery, Division of Hand Surgery, 1200 East Broad Street in Richmond, and go online, frankenhoffmd.com, or call 828-3815.